This training video is designed to demonstrate the changes that are being made to the eye and skin preparation portion of the donor preparation procedure. It's best if you have a copy of the procedure in front of you to follow along. As you will see, the new procedure is a more extensive one, which we feel will be a more effective prep. We have used a practice head for this demonstration. If you've used a practice head before, you know that the face is built for durability, not for its skin-like pliability. As a result, the eyelids of the practice head are difficult to manipulate, and we hope that you can imagine how the eyelids may be rolled and manipulated in a real donor recovery situation. The procedure steps prior to the eye and skin prep remain unchanged. Don your personal protective equipment. The new kit contains a paper gown, mask with eye shield, cap, and shoe covers. The kit does not include non-sterile exam gloves. You are responsible for packing the size that you will need. The new recovery pack will consist of two kits. The preparation portion is packed on top of the instrument pack. Set the instrument pack aside for later use. Aseptically open the prep pack. Both packs are sterile. Aseptically don sterile gloves. Sterile gloves are no longer included in the pack. Be sure to pack the size and number of gloves you will need for the procedure. Inspect the contents of the kit for completeness and carefully arrange the contents of the kit on the sterile field. Open the 2-ounce bottle of 10% povidone iodine and pour it into one compartment of the tray. Remove the outer seal of the sterile eye wash. Remove the cap and spray tip. Using the medicine cup to measure, pour 2 ounces of the eye wash into the cup. Add the 2 ounces of the eye wash to the povidone iodine in the tray, creating a 1:1 or 5% solution. Select 8 cotton-tipped applicators and gently mix the solution. Leave the applicators in the solution. Use a dry applicator to open an eyelid. Sweep the conjunctival fornix one time from the lateral canthus toward the nose with a povidone iodine dipped applicator. Discard the povidone iodine dipped applicator after each step. Repeat the process for the other eyelid. Select a clean, dry applicator and repeat the process for the second eye. Here you can see that it is difficult to get the practice head eyelids to roll back or retract. Avoid touching the cornea with the swab. The dry applicator can be used for both lids on one eye only. Use a new povidone iodine dipped applicator for each sweep. Use a new applicator to roll the upper lid back. Then use a new povidone iodine applicator to scrub the lid margin and lash line in a circular motion. Repeat on the lower lid. Using new applicators, do the other eye as well. As you can see, we have plenty of applicators. Fill a 3 cc syringe with the povidone iodine solution. Using a clean, dry applicator, roll the upper lid back and slowly drip approximately 1/4 of the syringe contents into the eye. This is about 3/4 of 1 cc. Repeat this on the lower lid. Using a clean, dry applicator, repeat the steps on the second eye, using 1/4 of the syringe contents on each step. When you have finished, you'll have used the entire syringe. Allow the povidone iodine to sit in the eyes. Dip a folded 4x4 gauze into the povidone iodine, blotting the excess liquid on the side of the tray to avoid dripping onto the work area. Apply the solution beginning at the lid margins and wipe in a circular pattern outward, extending from the tip of the nose to the upper forehead. This is repeated on the other eye. By the end of this process, be sure that all of the skin is prepped. Gauze can be used to absorb the remaining solution in the tray. The prep pack can now be discarded. Then discard your gloves. Aseptically open the recovery pack. Prepare additional supplies needed. Though not shown in the video, this includes Optisol GS, viewing chambers, and at least 2 pairs of sterile gloves. This portion of the setup is not changed from the previous version of the procedure. Perform a surgical scrub. Don sterile gloves and sleeves. The procedure for this is not changed. Arrange supplies on a sterile field. Viewing chambers are not shown here, but of course you will need them. Open the sterile eye wash bottle from the recovery pack. Using a clean, dry applicator, open the lids and thoroughly rinse the povidone iodine from the eye. Do not direct a stream directly on the cornea. Repeat with the other eye. This action will wash some of the povidone iodine from the face. The solution has been sitting on the face for a sufficient period of time to kill microorganisms, so it's okay for it to be washed off with the eye rinse. The eye wash is sterile and will not contaminate the skin. Use a clean 4x4 to gently blot the lids and skin around the eye. This will allow better adhesion of the drape. Repeat on the other eye. Aseptically place the drape on the head. The new drape is one piece and considerably larger. Your technique for drape application may vary. Just be sure to do it aseptically. Carefully secure the drape. Using the technique you've already learned, prepare the viewing chambers and fill with Optisol GS, removing contaminated gloves when finished. Then continue with the ocular recovery. Kits no longer contain supplies for the collection of a vitreous sample. Each Eversight affiliate will be responsible for assembling their own collection kits. As part of exposure control, a new style of needle has been included in the recovery kits. When you have finished using the needle and syringe, without removing the needle from the syringe, place the needle guard against a solid surface and snap needle into the guard. Do not engage the guard with your hands. Once in place, the guard cannot be removed. Do not try to remove the guard once it is in place.